The Core Saver Plan. This is Bankmed's plan designed for younger or healthier members with relatively few healthcare needs. It provides mostly comprehensive hospital cover with a limited medical savings account for day-to-day expenses. The plan offers a rich variety of wellness benefits and includes 2 insured Bankmed GP consultations a year for each beneficiary on your plan. There are designated GPs and specialists, but these are limited to prescribed minimum benefits, also known as PMBs or treatment baskets. Your GP will refer you to specialists within the specialist network. You have access to unlimited chronic medication in line with the prescribed minimum benefits chronic disease list. This is subject, however, to pre-authorization and services via the Bankmed GP network. There is a designated service provider or DSP for out-of-hospital conditions on the prescribed minimum benefits list. You have complete freedom when choosing a hospital, but pre-authorization, medicine formularies, and scheme protocols apply. If you're already on this plan, you'll be pleased to know that Bankmed has once again increased your current benefits and added new benefits for 2018. At the same time, we've managed to limit your contribution increase to 7.5% and increase your benefit limits by 5.5%. These are some of the new wellness and preventative benefits for 2018. Non-invasive prenatal testing is now available for high-risk pregnant women who are 35 years or older at delivery, women who have had a previous pregnancy with trisomy 21, 13, or 18, or where a fetal ultrasound or other screening findings indicate a high risk for Down syndrome. Another new benefit is newborn screening, including the early screening, diagnosis, and management of selected rare inherited diseases, such as phenylketonuria. Glaucoma as a screening test has been removed, and a pneumococcal vaccination is now necessary only once every 5 years, unlike the current provision of once a year. There are also new guidelines for network arrangements. An additional network is Premier Plus, which allows for a disease management program for diabetes mellitus and heart health. The day surgery network now includes a defined list of procedures. For example, an endoscopy, colonoscopy, tonsillectomy, circumcision, or myringotomy. If you voluntarily use a facility that's not in the network, there'll be a 1,500 Rand co-payment you'll need to pay in. Likewise, there is a 20% co-payment if you use a psychiatry facility that's not in the psychiatry network. If you're treated for major depression, bipolar mood disorder, and schizophrenia, you can now have a psychiatric consultation within 30 days of being discharged. And if you need medical and surgical appliances, take a look at the benefits and contribution schedule to see how many you can have and how often. Please be aware that there is a 30% co-payment on biologics and expensive drugs for non-algorithm items. For example, Section 21 drugs, which are those not registered by the Medicines Control Council for use in South Africa, and off-label drugs, which are those not registered for the condition by the Medicines Control Council. Remember, we value your health as much as you do. Here's to your good health.